Assalamualaikum warahmatullahi wabarakatuh. Abid to Dr. Fuzi. My name is IMANINA binti Muhammad SAPIRON, and today I will be presenting my thesis review titled The Impact of Implementing Electronic Health Record EHR System in Malaysia by Mazna Ahmad. For the introduction, Electronic Health Records (EHR) system is a digital system that used to manage patient health records and support healthcare services. And EHR implementation has improved healthcare efficiency and support clinical decision making. However, challenges such as system complexity and user resistance may affect its successful adoption. So this study to examines the impact of the implementation of EHR on two things, which is the system service quality and healthcare practitioners' performance. For the problem statement, for the first one, the implementation of EHR still faces various operational and organizational challenges. For the second one, the complexity of EHR system and integration issues may affect the user resistance and the system effectiveness. The third one, there is still limited understanding of how EHR implementation may affect the healthcare practitioners' performance and service quality. For the research objective, the first objective is to investigate the differences of EHR implementation between two healthcare institutions. The second objective is to examine the impact of EHR implementation on system service quality and individual performance. And the third objective is to determine the relationship between system service quality and the individual performance among the healthcare practitioner. For the research question, the first one, how do the selected healthcare institution implement the EHR system? The second research question is, do differences in implementation process will influence system service quality? And the third research question is, does system service quality may affect the job performance, professional autonomy, and well-being? Next, we move to the operational definitions. There is four terms that I'm currently seeing in the thesis. The first one is healthcare practitioner. Healthcare practitioner are the medical professional who use the EHR system in their daily work, such as doctors, nurse, and medical record officer. Next is system service quality. That is refers to how well the EHR system meets user needs in the terms of usability, system interactivity, and the security. The third one is individual performance. This is refers to the how EHR implementation system help the healthcare practitioner to improve their work productivity, to reduce their error, and perform their work effectively. And the last one is professional autonomy and well-being. This refers to the level of control and independence healthcare practitioners have in their work. So basically, the professional autonomy and well-being is to instruct how the doctor or the nurse or the medical record officer can make a clinical decision making in the critical or serious thinking. Next, we move to the research methodology. The thesis is used the mixed method approach where they use qualitative and quantitative method. So for the qualitative method, they conduct the preliminary interview with the healthcare practitioner, such as the IT personnel and doctors from University Malaya Medical Center and Hospital Putrajaya to explore how they undergo the EHR implementation on their hospital. For the quantitative method, they conduct a structured questionnaire survey involving 262 healthcare practitioners between the two hospitals. And the collected data were analyzed by the software of SPSS, specifically through the independent sample t-test and correlation analysis to evaluate the relationship among the study variables. So basically, we use SPSS to get the p-value for the results. Next, the scope of the study focused only on two hospitals, which is University Malaya Medical Center and Hospital Putrajaya. However, the study had limitations because it involved only two hospitals and they got the result relatively for the small sample size. Next, we move to the conceptual framework. As Dr. can see, we have three elements in the conceptual framework. For the first one is to answer the first research question, which is it briefly to compares the implementation models that used by UMMC and Hospital Putrajaya. The second component is to answer the second research question and act as independent variable. The second component is for system service quality that through five dimensions. For the first one, usefulness of information, adequacy of information, usability, system interactivity, and security and privacy. And the third component is to answer the third research question and act as dependent variable, which is the individual performance. In individual performance, we have professional autonomy and well-being. So this framework proposed the differences in EHR implementation process may influence system service quality, and in turn, the system service quality may affect the performance of the individual healthcare practitioner. So we move to the results and data analysis. To answer the first question, the findings showed that both hospitals shared the same goal of improving healthcare service quality and supporting clinical decision making. However, their implementation approaches were different. For the UMMC adopted a more strategic and infrastructure focused implementation with a comprehensive planning, while in contrast, Hospital Putrajaya followed a gradual implementation approach that placed a greater emphasis on user feedback and continuous improvement only. Well, to answer the second research question, the finding is yes, there's a differences in implementation process do influence the system service quality. And the study found a significant difference in system interactivity only with a p-value of 0.007. And the results show that Hospital Putrajaya recorded higher system interactivity other than UMMC. This indicates that better communication and interaction between users and IT admin can improve their quality of the system service. And the third finding to answer the third research question is for individual performance, the study found no significant differences in job performance. Um, and well-being between the two hospitals. However, among all service quality factors, security and privacy was the only one factor that significantly associated with job performance. This indicates that better protection of patient information can contribute to the improved effectiveness among healthcare practitioners. For the recommendation, first, enhance system interactivity and user engagement as establish effective communication channels between the healthcare practitioners and IT administrator. Second, conduct regular feedback sessions to identify and resolve system-related issues. The second recommendation is provide continuous training and technical support as organize regular training program to improve user knowledge and skills in using EHR system. And second, provide ongoing technical support to assist users when system problem occur. And for conclusion, the study achieved its objective by examining the impact of EHR implementation on system service quality and individual performance, and the findings showed that different EHR implementation models had minimal impact on overall performance, but system interactivity played an important role as security and privacy were identified as the most critical factors that affecting healthcare practitioner performance. Therefore, successful EHR implementation required continuous support, effective user engagement, and strong security measures. That's all from me. Thank you.